And the Nigerian Health Minister, Isaac Adewale, has also warned all health professionals to investigate every case of fever before treatments. With us here in the studio to discuss this is a public commentator and a health expert, Femi Ogeyingbo. It's good to have you join us on News.
Thank you for being here.
Yeah, thank you.
First of all, let's start with how equipped these doctors and medical officers are. How infrastructurally enabled would you say they are in responding to critical matters like these outbreaks?
Well, the challenge that we've been having in the health sector is very recurrent. And one of the facts remains that in treatment of epidemic situations like this, most of the time they do blind treatment when people come in for fever, when they don't have adequate laboratory analysis of what is wrong with the patient. Because Lassa Fever itself is curable if you are able to detect it between 6 to 21 days of the patient coming down. So my challenge is that the areas of these issues are areas where we are not well equipped in terms of analysis, in terms of making patients to go for tests, proper tests, and discover ab initio what is wrong with the patient, and then you follow up on your treatment. Because Lassa Fever presents with similar symptoms with many other things like typhoid, even malaria. Sometimes you just start treating malaria and the patient has gone into almost 10-15 days before you're thinking of Lassa. It's already late. So that's what I think.
Why isn't that in our subconscious, especially at this time of the year? Because it is at this particular time of the year that we usually have the Lassa Fever outbreak. You
know, the problem is we are always fond of this fire brigade approach. This is not the first time Lassa Fever issue is coming up. I expect that even when it was caught, research should still go on. They still go on collaborating and equipping health centers to be able to match, prepared for, such cases, so that it won't even happen at all. Even if you have doctors coming down, dying as a result of Lassa Fever, it is usually going to be the fact that while treating, it doesn't have enough protective materials that can give him a barrier within the...
That's why I was expecting you to, that's the path I was expecting you to tell earlier when I asked about how equipped they are. Because, I mean, recently, was it the World Health Organization that came out and said in Nigeria we have a situation where there's just one doctor to about 600 or 6,000 patients, and that's not supposed to be. So is there a lack of enough medical officers and equipments available? Is that why we're having these recurrent cases?
You see, the issue is multifaceted.
Right.
One, you cannot shy from the fact that there's a brain drain. The doctors some of them are not willing to pick up government job. Some are traveling out. So definitely there is a lacuna
which is not their fault anyway.
And it's not their fault. And the government too has to just look at the way, because the population is increasing every day. And then the people that are prone to this kind of situations are people that have hygienic issues, people that live in crowded areas. You can imagine people that live even in the rural areas that have so much rodents around, which of course is the vector for this particular disease. So I think we have to look towards a way to encourage more doctors to come on board, give them probably better life.
And encourage the ones on board, encourage them even more, not all their salaries.
If you have one doctor attending to about 100 patients, there is tendency for him to do blind treatments and assume, and if they all have to go for tests before they come back for reviews, I mean, it's killing.
You said that Lassa Fever is preventable. Now, it is not only preventable, it is also treatable.
Also curable, yes.
Yeah. So this infection, the prevention, and then the control, why are these procedures not strictly adhered to?
Well, one of them is awareness. Do people really know what we're talking about? For instance, in preventing Lassa Fever, you need to make sure you keep your food in rodent-proof containers. You need to make sure that your waste is disposed far away from home. Even as much as keeping cats in your house, it will drive them away. And you won't have contact with them.
That's a measure.
That's part of the prevention. Even when you are treating the patient, the person treating should be sure that he is not having any contact with the fluid from the patient. Otherwise, it's likely to have infection as well.
Right. Now, we have you here, not just as a health expert, but a public commentator. So I'm going to ask you this. Why do you think, as critical, as life-threatening as these issues are, I mean, you don't see tough stances from authorities when it's needed? I mean, we're seeing how these cases, for instance, could be prevented and treated, but I mean, we're talking about 107 persons under surveillance, 61 deaths. What's going on in the government's coffers now?
That's why I said it's a continuous process. Now, we're in a situation now, all hands are on deck, everything possible is being done to get out of this situation. The very minute we move out of this situation, we go and relax.
No, the question is, are you satisfied with the rate at which things are being done? What would you like to see done?
Well, what I would like to see done is a continuous improvement on what is on ground and continuous awareness.
When you say what is on ground, what is on ground?
Exactly.
Well, what is on ground is what we have. The number of doctors you have available, the available number of tests you could do to discover the sickness.
What are the challenges hampering improvement?
The challenges I've seen here is ill-equipment. They need to get more equipment. They need to get up more laboratories. More people need to be trained. And even awareness for general public should be done. Because a lot of people don't know how dangerous it could be to have rats having their feces on your food, even on the cans you're drinking, and just ignorantly.
A lot of healthcare practitioners, professionals actually die of this disease. Why is it that the healthcare practitioners don't employ proper barrier nursing and infection control practices? That is what is most important.
You see, there are two situations here. The doctor is overwhelmed, a lot of patients are in already.
Right.
He's doing like a broad, spectrum treatment.
Yeah.
He doesn't know he's dealing with Lassa Fever already. The patient has come 1, 2, 3 times. And by the time he's coming down so heavily at the later stage of the incubation of the virus, he's already in contact. He doesn't know what he's dealing with, ab initio. So he's contacting
and maybe he's not even provided with enough equipment.
Exactly.
So he's back to square one for...
Because if you're treating malaria, you don't need all the gadgets to prevent yourself.
Well,
okay,
let's just hope that this
situation gets better. But we'll leave it here for now because of
honestly.
time. Femi Ogeyingbo, thank you once again
You're most welcome
for joining us on the News Hour.
Thank you.